Dr. Mukesh is here and he want to consult with you regarding his other issues. So if you allow, then I can invite Mukesh.
No problem. Yeah.
Hello, doctor.
Hi, Mukesh. How are you?
I'm good, doctor. How are you, doctor?
Good.
Yeah, doctor. Doctor, my question is my cousin fainted and had a seizure while visiting Varanasi. Yeah, brain scan showed the clot in the brain venous system, and she was prescribed a blood thinner.
Mhm.
Why did it happen, and is the right treatment, doctor?
So, the question, as I understand from Mukesh, is your family member had a venous clot in the brain, which has led to a seizure, and currently she's on a blood thinner. And you were asking if the treatment, if that is the right treatment, right? So yeah, so the condition that you are describing is what we call as cerebral venous sinus thrombosis, where uh, this happens in there are various factors which can cause this condition, and this is actually rare. But however, we have been seeing cases where people are having clots in the venous system of the brain. What happens is whenever there is a clot in the venous system, it will block the drainage of the blood flow, and there will be increased pressure in the brain, which subsequently causes, sometimes rupture of the blood vessel causing bleeding, and that can irritate the cortex and of the brain, and that can cause seizures. Unfortunately, even if someone has a bleeding from this problem, the treatment is to dissolve the clot, and for that we put the patients on a blood thinners, and when we put the patients on blood thinners, the body will facilitate so that the clot gets dissolved, and putting a blood thinner will help to prevent the propagation of the clot. And in extreme cases, if if the pressure is so high in the brain, we do a procedure where we go in and try to remove the clot in the venous system of the brain. And overall, this condition is caused by various factors. One is it could be due to uh, cancer. It could be due to some sort of for a younger woman, like as you were talking about, could be a combination of history of migraines with birth control pills, or any hypercoagulable disorder. Like if someone has a genetic history of clotting disorder, and any history of substance abuse, like any other drugs. These all can cause clots in the venous system of the brain, and absolutely the treatment, whatever they have prescribed, we say a blood thinner. Typically, what we meant by blood thinner is what we have is like apixaban or warfarin, Lovenox. So these are the blood thinners, and the current treatment for patients is blood thinner. And as your family member, whoever has this problem, is on the right treatment. If at all, if that is what you're asking.
Thank you, doctor. And I also have another question related to this. She can she pregnant safely, and what are her risks, doctor?
So if she is a young reproductive age group person, then she has to take appropriate precautions. What it means is She has to be on right blood thinner, and what I would recommend is for her to stay with the course for 3 months of blood thinner. After 3 months, we need to repeat her scan again. And after we repeat the scan, we make sure there is no clot, and then she can safely become pregnant. Based on case by case basis, we recommend for some patients to actually be on a prophylactic Lovenox. But again, it depends upon her risk factors, and this has to be discussed with her gynecology and obstetrician, and make a decision whether she needs to be on prophylactic Lovenox during her pregnancy stage. But however, if her clot is related to something like a provoked factors like dehydration or oral contraceptive pills, we remove those things in the picture, then absolutely she will not be at a high risk for clotting. However, if she has any clotting disorder, then we have to choose appropriate anticoagulation during her pregnancy.
Yeah, thank you, doctor. Thanks for your suggestion.
Welcome.